Good morning, guys. I hope we're all sparkly. It's safe to say that I'm not feeling very sparkly right now. In fact, I'm pretty grumpy. I'm especially grumpy because I did this video about half an hour ago, but it recorded without audio. So here we are again. Can I regurgitate the same information? Well, these videos, they're not scripted, they're spontaneous. So we'll give it a go because it was all right. And I was re-listening to it, re-watching it and going, oh, that was a waste of time. But nothing's really a waste of time. We need to learn from our mistakes. And what did I do wrong? Nothing. The iPhone just didn't work properly. I've had to reboot it and now it's working properly. Thanks, Apple. But yeah, I'm feeling pretty grumpy because of lots of reasons. And lots of reasons that I shouldn't really care about. So let's start with a poem. Dr. Stevens reads poems. No, he doesn't really read poems. But there is this one poem by Roger Kipling, If. It's about how to be a man. And one of my favourite lines is, if you can meet triumph and disaster and treat those two imposters just the same. It's that realisation that we're surrounded by psychological stress and it's all an illusion. And we just need to appreciate it, the good, the bad and the indifferent, and keep moving forwards. So yeah, as I've said before, we release the same neurotransmitters and hormones with physical stress as we do with psychological stress. But we're physical beings in a world of psychological. Yeah, one more time. So what's going on? Well, yeah, I've literally beaten myself into a state of ill health. Yes, it's all about balance, Dr. Stevens says. Do as I say, not do as I do. I had an operation a few weeks ago. I had a septorhinoplasty, a uvulopalatopharyngoplasty and graft. And as usual, my gung-ho attitude, the prof said, at least 2 weeks. Do not do anything for at least 2 weeks. So I protested and he said, Rob, okay, 1 week, but just gentle cardio. Did I listen to him? Well, I physically couldn't do anything for a week, but when I could do something, yeah, I hit it. Of course I hit it because I'm invincible, but I'm not invincible. I've worn myself into the ground. I had a bit of a post-op infection, oral thrush from high-dose antibiotics and steroids, so I was pretty grumpy because of that. I tried my best to rest, but I'm not very good at resting. So what did I do? I went back to the gym and I started pushing it as much as I physically could within reason. But that wasn't the right thing to do. I should have been more considered and I should have been more balanced with my approach. But here we are. So what happened then? Well, we'd pre-arranged a TMHC fan dance winter hike. So yeah, on the Sunday of the hike, I woke up with a banging headache. So I took some painkillers, fluids. You'll be all right, doc. So we did the fan dance. To everybody that attended, my God, you are legends. Or is it lunatics? Lunatics, probably. But hell, yes, no surrender. He who dares, brothers, he who dares. If you don't know what the fan dance is, it's the 15-mile Special Forces fitness test. Up, penny fan, down, up Jacob's ladder, back to the red phone box. And I've done it many times before, but this time was different. Not only was it very precarious, it was icy, it was cold, it was miserable. Well, it's winter, isn't it, obviously? But I had zero going up Jacob's ladder. And I've never stopped going up Jacob's ladder. I had to stop 3 times. So I kind of knew something was up. And then it's culminated in a pharyngitis, needing antibiotics, and feeling pretty sorry for myself. Do I feel sorry for myself? No, because I'm not a wuss. But I'm disappointed because I can't be physical. I can't get to the gym. I can't do my ice baths. I can't do my sauna because it's placing too much stress on my neurovascular system. And I'm going to beat myself into the ground because I'm pretty prone to burning the candle at both ends. In fact, I'm pretty prone to taking a blowtorch and just destroying the candle because it's all about balance. Dr. Stevens, do as you say. Come on, come on, come on. But it's all a learning process, isn't it? And with low testosterone, you're utterly robbed of that drive and determination and motivation to keep going. You're physically incapable of doing the things that you used to do. You're a shell of your former self. And that testosterone replacement therapy, that catalyst, gives you back that oomph, that joie de vie, to allow you to put the effort in to achieve the reward. And the reward's an illusion, because again, the determined effort you put in is your reward. But sometimes you have to take a step back and be a little bit more considered about your approach. So we bang on about yin yang, we bang on about the fact that you should be active and rest. Sometimes life will throw curveballs at you, whether they be psychological curveballs or whether they be physical curveballs. And again, we need to have that considered approach. And we talk about testosterone, and the press talks about it as being this aggressive hormone, this alpha masculine, rah. But actually it's a calming hormone. So most of my guys, they come for their annual reviews and they say, I feel calmer. It's been a crappy 12 months, but do you know what? I've coped better than I would have done without testosterone replacement therapy. Because again, it's the counterbalance to cortisol. Testosterone will give you the ability to work your butt off to earn your reward, as long as you're considered in your approach. Now, we know that testosterone has that wonderful relationship with dopamine. So again, men, we're goal driven. So we are logic driven. So when you go on testosterone, you are now the man you need to be. No, it's going to take work. You can't undo the wrongdoings of 20 years, but you can work from right now, the only moment that matters, to become a better version of yourself and lead by example. So this relationship of testosterone with dopamine means, yes, goal driven. And perhaps that was my mistake, because I'm on testosterone replacement therapy. So I'm not a shell of my former self when I'm feeling poorly. I'm still revved up. The amplifier is still turned up to 11 because it's one louder. It was 10 when I was natty, but I'm on testosterone replacement therapy, so it's one louder. So I need to use it. I need to get on with it. But you also need to be considered again. You need to take that step back and be considered in your approach. Because, yeah, I've beaten myself into the ground. And here I am ranting again on one more video. Talking about yin yang. Practice what you preach, Dr. Stevens. So the testosterone, it is turning the amplifier back up to 11. So what does that mean? Well, we talk about testosterone as being an important part of the equation, and your hormones, chemical messengers that help facilitate the function of their target organs. But they provide that chronicity, don't they? They provide that base of the pyramid to then build up to the nervous system, which is acute, and then the consciousness on top of that. So again, if you're turned up to 11, to be the best version of yourself, you need to approach everything else. Now, that means obviously look after your health, but it also means look after your stress, your sleep, your nutrition, your exercise. Now, you can continue down that path of not doing the right things, but ultimately it will bite you on the arse, because I do most things pretty good. But this one, I didn't listen to my body. I listened to my brain, which says you are invincible, Dr. Stevens, because I am invincible. No, I'm unstoppable. Oh no, I'm breakable because I had low testosterone. Oh, okay, yeah, what is it all about? Yin yang. It's Carl Jung. It's in the first 40 years of your life, you're building a healthy ego. The next 40, you're looking inwards to get rid of it. Because it's what about what? Yeah, it's about balance, baby. And we live in this place of comfort. We've already reached the destination. We're not supposed to reach the destination. We're supposed to fight to survive. We're supposed to expose ourselves to hardships to survive. We've already survived. So what's left? Well, if you understand your physiology, you need to live by your physiology. And whilst we've appreciated that and we've arrived at this destination, we still have those integral primal drives working. And we face an epidemic of depression, anxiety, because everybody's lost in this perverse civilized world of comfort, because you're not supposed to ever reach the destination. But if you have that appreciation and understanding of your physiology, you can then move forwards within this place of comfort to be the best version of yourself. Now, we often engage in negative self-destructive behaviors. I know I do, but I'm trying not to. So I'm always trying to be a better version of myself. But rather than going to the pub or doing whatever you might do if you're a naughty boy, what you should be doing is doing things like the fan dance, pushing your body physically, and you will be positively rewarded for those physical acts. Now again, if you've reached a goal, you've reached a destination, you've got rid of the dopamine, what's left? Nothing. So again, you must go, right, okay, well, what's next? What's my next one? So we're going to Sweden, we're doing Mont Blanc, and with lots of more adventures, and we'll do a TMHC Snowdon hike in autumn. So come along and join us, because it's the determined effort, and it's the community that we're building, the strong community of like-minded guys and girls that will make sure we all prosper. We all lead by example. We are one consciousness, experience itself subjectively. It's better to give than take. So yes, be the best version of yourself to allow you to be the role model that you could look down on and go, pretty proud of you. What are you going to do? Rest? No, I'm going to keep going. I'm going to do what? I'm going to earn my reward.